Good evening. A GP surgery in Hampshire faces an uncertain future because of a long dispute over the renewal of its lease.
The lease on Branksome Wood Road Healthcare Centre in Fleet expired last year and the NHS has not yet reached an agreement with the landlord. It means improvements to the surgery can't be made.
Staff say the situation is leaving them stressed. They want a quick resolution so that they can provide the best service they can for the thousands of patients who rely on them. Cara Digby reports.
At this GP surgery, it's business as usual for patients coming in. But behind the scenes, it's a different story. Since March last year, Branksome Wood Surgery has operated on a temporary lease, costing around £30,000 in legal fees. That's because there's an ongoing dispute between the local NHS Care Board and the landlord over the cost of renewing a permanent lease. And now the surgery is left in limbo.
It's a really stressful situation thinking that we're responsible for this building, but actually we don't have control over how the funds flow. And our patients and our community look to us to provide a good service, good clinical care in a safe environment. And we're struggling to be able to do that now.
Around 28,500 patients are cared for between this surgery and its partner surgery. If this building had to close, it would have a huge impact.
We're very short of practices in Fleet, very short of capacity, so not to have this would be terrible, terrible.
The main disagreement is believed to be over the value of the car parking spaces. The practice wants to expand the building to improve care, but it can't apply for any funding if it doesn't have a permanent lease.
We're having difficulty seeing patients because we don't have enough rooms for our clinicians to work from. So at the moment it's one clinician in, one clinician out on some days. We're also a training practice hosting up to 7 to 10 trainees at any one time. And if we don't have enough space for our trainees, that means that we can't host them.
Ruth is training to become part of that next generation of GPs.
When people aren't happy around because we can't fix the roof or the flooring needs doing or whatever it happens to be, there isn't a space to have a chat with a colleague without lots of people overhearing. That impacts your job satisfaction and you feel that as a member of the team.
I think it just makes us feel really concerned about the amount of time that is taken up by our GPs having to deal with this. When they could be seeing frontline patients, they're having to deal with legal issues that are probably actually beyond their normal scope. It seems unbelievable that we are going through all of this 18 months plus on what I think is about the 8th extension of the lease, and we're getting nowhere.
The government's valuation office advises the NHS on new leases for GP surgeries and says it's working hard to progress cases, but that it isn't party to any disputes. NHS Frimley Integrated Care Board says it wants to ensure value for money and secure the quality of facilities. A spokesperson added, "We are awaiting the outcome of negotiations between the district valuers and the agent acting on behalf of the practice, which would enable us to move forward."
It is wasting huge amounts of money. I know we need a good, cost-effective solution for the taxpayer, but delaying the solution is becoming more and more expensive, and the organisation footing the bill for that is the GP surgery.
Vale Williams, which represents the landlord, told us the practice retains a legal right to occupy the premises and the landlord wishes to conclude a new lease arrangement as soon as possible. All such leases are subject to NHS approval. Staff here are not looking to take sides. They just want the problem solved and quickly to secure the future of healthcare for their patients. Cara Digby, ITV News, Fleet.